You are welcome to my channel. Thanks for listening. Please remember to subscribe if you haven't. But if you have subscribed and you have listened again, I'm saying a big thank you. Today is about post-traumatic stress disorder, but I'll be limiting myself to risk factors on. Without further ado, let's go. There is a separate presentation on post-traumatic stress disorder A to Z, where you're going to find full info as per the definition of PTSD, ASD, that is acute stress disorder, signs and symptoms, the treatment, diagnosis, risk factors, triggers, and the list goes on. So if you want to listen to that and get full info, please click on this link. Thank you. Now, the risk factors. Almost anything happening in the medical field in this generation could be traced to the gene. So, hereditary or genetic factor will play a strong role here. Then, female gender. Some authorities will put the ratio of PTSD in female to male as 4:1 respectively, while others will put the ratio in female to male as 2:1. Either way, it is more in female compared to male. And some give us explanation that it is mostly due to cyclical estrogen that has made the frequency in women to be higher than in men. Then, higher level of stress hormones. Well, once there is PTSD, we expect stress hormones to be high. Fight or flight. And that is about epinephrine, that is known as adrenaline, or norepinephrine, that is known as noradrenaline. Cortisol, growth hormone, and glucagon are all stress hormones. So, hypothalamic pituitary adrenal axis is greatly involved here. And that will be addressing corticotrophin releasing hormone from the hypothalamus, adrenocorticotropic hormone from the pituitary gland, and of course, cortisol, adrenaline, or epinephrine from the adrenal gland. When it comes to other risk factors like the brain itself, everything happening is happening within the brain. The processing of the context will involve the hippocampus, prefrontal cortex, and amygdala. Alteration in the normal impulse that traverses these or the activities there will lead to a kind of fixed condition that will put the experience there as if it is still happening when in the real sense is no more there. In psychiatric disorders, there are some associated psychiatric problems that could worsen PTSD. So PTSD will be associated with anxiety. For example, generalized anxiety disorder with panic attack and some specific phobias like agoraphobia and just anything that has happened before, then you develop kind of fear that you don't want to go near it again. Then you have phobia as per that very event. And then depression is not far away from PTSD. As a matter of fact, by the time we are dealing with symptoms, you understand better that from there it could lead to suicide. That is why Many with PTSD who are not being helped properly or who are shying away from expressing themselves and they are not seeking help may actually commit suicide. Then, drug abuse, drug use. As a matter of fact, we need to rule out all these things before we make the definitive diagnosis of PTSD. And of course, obsessive compulsive disorder and somatization. Then, there is this entity known as acute stress disorder. That is what we will all experience in the first month when we're subjected to traumatic event. Many people will get out of it that time, but majority will not get out of it and they come down with PTSD. I'm not going to take your time explaining that in details here because there's a separate presentation for that. Then adjustment disorder could be the problem and could even be complex PTSD, in which case it's going to be associated with repeated events. PTSD here is associated with one event in many of the PTSDs. But when it is complex PTSD, then there's a repeated event. The defining clinical feature with complex PTSD is that it is with dissociation and the perception of self in a negative term, like having no negative self-image is found in complex PTSD. Emptiness or lack of social support. That's a big risk factor. I just gave this example here. That's what I could pick with the Microsoft 360. So in this case, like somebody you're married, you have kids, the kids are grown, they've finished schooling, they're out on their own, and you're by yourself, maybe through divorce or death, the spouse is not there, or you are not even married, there's no job, you don't have friends around, no social support. All this could worsen PTSD in anyone who will be subjected to traumatic events. Social stressors like divorce. I've just alluded to that while explaining emptiness condition. Then a repeat episodes or similar events reoccurring. Some people can cope with one event as acute stress disorder and get out of it. But when it is repeating itself, then the memory of what happened the first time will just flash back. And then now it's repeating itself. Even another time when it's not there, the brain will play the video back to them that you're about to have an accident again. Then they are now in PTSD full blown. Then medically related impairment. In this case, the medically related impairment means that you are physically impaired and then you are exposed to traumatic events again. That can lead to a palpable fear, or you begin to figure it out even before it occurs that now that I'm not capable of running, what if someone is shooting nearby, or what if there's fire outbreak, or even arson, maybe somebody's setting the house on fire, how will I get out? How will I escape? You understand what I'm trying to say? So that alone, you begin to process what is not there. You begin to develop fear in what is not even there at all. Double insults. How do you mean by double insults? Yeah, someone has been exposed to a traumatic event like road traffic accident, then the same individual is being subjected to emotional insult or physical abuse. So trying to get out of one, another traumatic event has occurred. So that could tilt the individual to PTSD. I don't want to delve too much into race because PTSD is going to occur in any race, any age, all over the world. Though it's worse in some people, but I don't want anybody to feel bad. Let us just take it that PTSD will occur in anyone, anywhere, at any age, except in infants and not too young kids. Then low level of education could probably worsen the situation because like you are listening to this presentation right now, if you listen to the full presentation where every aspect is being covered, you understand that I would have explained how you can avoid PTSD, what you can do, how to seek help quickly. But some don't even have internet to listen to this, so that could affect them negatively in the sense that they keep brooding and brooding on the negative events in their life. Is flashing back, it's affecting the way they are thinking, it's affecting their occupation, their relationship with people around them. Now, low socioeconomic status and age. When it comes to age, it is worse when the traumatic events occurs in childhood, particularly at the age when a child can remember the events. If it occurs in infants, for example, who will not understand anything, but like even those kids in some schools where mass shootings took place in recent years, though they were in elementary schools, now they are growing and growing without memory. That is pretty bad. It's not good at any age, but imagine somebody passing through PTSD from childhood, taking PTSD from elementary school to high school, then to the university, and to marriage, and to war. Is going to shape, redefine them completely. They are going to form a separate personality entirely. And of course, the nature of the trauma. We all pass through different things, different times. People bear it differently also. Religious belief. Some believe that whatever happens is natural, is your destiny, is what superior being has planned for you. So take it like that. Even when they have children and the children should die, they are going to say, some will say, the superior being gave you and the superior being has taken, so you bless the superior being and then you continue to live your life. They won't want to brood on it, and even when it flashes back into their brain, they know what to say and what to do, and they move on with their life. So religious belief could help some people not to stay on as PTSD, but sometimes some other forms of belief could allow them to brood more and more, meditate more and more, because some religious beliefs will tell you you have to meditate. Meditate on everything around you. And culture. There was a case of some people that I have known of that while in labor, they don't yell, they don't cry, even with waxing and waning, uterine, painful contractions. Why? Culturally, they don't. And in some cultures, they believe that men don't cry, men don't wail. So, in people like that, the way they're going to handle painful or traumatic events will likely be different based on culture. Idiosyncrasy. Why? This is a unique or peculiar way of thought and reaction to events that is peculiar to an individual. And it could go to the negative side that the person will become eccentric. So what will make some people to have PTSD, some other people won't because of the way they take issues in life. So I can give an example here and then I will end this presentation. There is a family that I knew of very well that they wouldn't tell their mom if they'll be traveling home. Why that? The mom will be half dead before they will reach home because she will be calling every 10 or 20 minutes to find out where they will be. So they've decided our mom will die of panic attack, high blood pressure or heart attack before reaching home, so they won't even tell her we're driving home. So imagine that. Some will say, don't tell mom yet, or don't tell dad yet. It depends on who could, be a certain story, certain news. And with that, I've come to the end of this short presentation on associated risk factors when it comes to PTSD. Thanks for listening. Remember once again that if you want to listen to full info on PTSD, kindly click on the link that I provided earlier. I appreciate it. Thank you.